Today the most important topic is the assessment of the patient in the emergency department. In the emergency setup, the most common thing is that overcrowding, and how to sort out the patient, we call it a triaging. So before patient goes to the doctor, that patient must have been properly sorted out that where it should go. So all patients presenting to the emergency department will be triaged and categorized according to the level. Nowadays, three different triaging systems are being implemented. One is the Australasian triaging system. The second one is the Canadian triaging system, that is also called CATS. And third one is the Manchester triaging system. The most commonly used, and in the USA and Canada, is the Canadian triaging and acuity system scale. So all patients admitted to the emergency department will have to be triaged according to the CAT scale. So what is the triage? It's a definition. Triage is the process used to sort patients in order of acuity or the severity of their illness. So triage is designed to get the right patient to the right place at the right time with the right care provider. And rapid access to healthcare provider so that proper assessment can be enhanced. So what is the objective? The objective of triaging is to rapidly identify patient with urgent or life-threatening condition. Second, to determine the most appropriate treatment area for patient presenting to the emergency department. To decrease congestion in emergency treatment areas. To provide a logical mechanism for ongoing patient assessment. And to provide information to patient and families regarding expected care and waiting time, and to provide reliable information defining department acuity. So, more in different setups, the nurse is the responsible healthcare provider for triaging. But in some setups, doctors are also doing triaging. But it has been found that the nurse is the best in triaging the patients. So, we will only see the responsibilities or the duties of the triage nurse. The triage nurse should have a rapid access to or be in view of the registration and waiting area of all times, that the staff nurse or the triage nurse, where she is triaging the patient, must have the eye over the waiting area so that she can observe any patient who can collapse over there and she can upgrade the skill. Second, greeting patients and families in warm and emphatic manner. Nowadays, the health profession is going to be a professional and industrial. Therefore, nowadays they are following the aviation industry also, that the staff, that the triage nurse must greet the patient as the air hostess are greeting the patient, the passengers. Third one is the performing brief visual assessment. While the patient is entering in the triage room, the triage nurse must have a visual assessment. Triaging the patients into priority group using appropriate guidelines. What are the guidelines? These are the Canadian Triaging and Acuity Scales are the guidelines. According to that guidelines, she has to prioritize the patient. Transporting patient to treatment area when necessary. Some patients, however, come by any way to the triaging area but unable to proceed to the treatment area or to the healthcare provider. Therefore, the triaging nurse must transport the patient in the wheelchair to that respective area. During this time tenure, another staff nurse or she has to call another staff nurse to not stop the triaging process. Then measuring the relevant vital signs for appropriate determination of triage. She has two ways to determine the vital signs, digital apparatus or manuals. Whosoever she wishes, she can do, but according to the organization's provision of the apparatus. Notifying patient and families of delays. She has to tell the families or the attendant or the patient why he or she has been delayed during for the triaging because of reasons. What are the reasons? 1, 2, 3. She has to explain to the patient. Reassessing waiting patients as necessary. Sometimes she levels the patient 4, but while the patient is waiting, can deteriorate, and she has to observe, as I told you before, that she has the access to the waiting area. So she should bring the patient back, or she should level up over there, so patient can get early treatment or the management. Then triage nurse must tell the patient after triaging, if you feel any uncomfortable, then you must inform me so she can again retriage the patient or level up to the patient for the treatment. Now, what are the qualifications for the triage nurse? There are different qualifications for the triage nurse, but the communication skills are crucial. Provider must interact with patients, families, police, emergency squads, personals, and visitors according to the local language. If she is not familiar with the local language, she should get the courses to learn that language. Must have a tact, patience, and understanding, and organization skills to deal with patients, lineups, inquiries, and unexpected problems. Patient can shout at her, patient can tease her, patient can abuse her, but she should show the patience to the patient. Must have the experience, skill, expert clinical judgment to recognize patients who are sick. Must be able to work under stressful conditions. And accurate assignment of triage level to the patient. And this depends upon practical knowledge gained through experience and training, correct identifications of signs, symptoms, and key information from the presenting complaints and relevant history. Use of triage protocol. As we know, the triage is a dynamic process. A patient condition may improve or deteriorate during the wait for entry to the treatment area. Now, the things which are required in the triaging area must have been familiar to the triage staff. For example, If the patient sitting over there and he is shivering or suddenly having altered state of consciousness, she must understand that patient can have a hypoxia or patient can have hypoglycemia. So, along with this digital apparatus of measuring the vital signs, the triaging staff must have the glucometer. She should immediately check the blood sugar level of the patient so that she can send the patient in appropriate place, or she can grade the patient to level 2 or level 1. So these are the important issues that a triaging nurse must understand while